Did you know that 1 in 10 people worldwide suffer from kidney disease? And most of them don't even know it? Can you recognize the subtle, strange signs that your kidneys might be failing? If not, you could be missing out on crucial warnings that could save your life. Our kidneys are silent workhorses, filtering waste and balancing our body's fluids every single day. But when they start to fail, the signs aren't always obvious. Recognizing these symptoms early is vital to protecting your health and preventing irreversible damage. Kidney-related issues are on the rise, with millions of people at risk. Yet many are unaware of the warning signs until it's too late. The challenge is clear. We need to be more aware of what our bodies are telling us. In this video, we'll reveal 10 weird signs that could indicate your kidneys are in serious trouble. Weird sign number 1, ammonia-like breath. One of the earliest and most unusual signs of kidney damage is the presence of an ammonia-like odor on your breath. This peculiar symptom, often described as a metallic or chemical taste, occurs due to a buildup of waste products in the blood, a condition known as uremia. When your kidneys are functioning properly, they filter out toxins, waste products, and excess fluids from your blood, which are then excreted through urine. However, when the kidneys begin to fail, they can no longer efficiently perform this critical task. As a result, waste products, including urea, start to accumulate in the bloodstream. Urea, a byproduct of protein metabolism, is typically expelled from the body through urine. But when kidney function declines, the body attempts to eliminate excess urea through other means, including the breath. In the mouth, urea is broken down into ammonia, which gives off a distinctly foul odor and a metallic taste. This ammonia-like breath can be alarming and is often one of the first indicators that something is seriously wrong with your kidneys. The presence of this symptom should not be ignored, as it signals the early stages of uremia, a potentially life-threatening condition. Uremia occurs when waste products reach dangerously high levels in the blood, leading to a cascade of harmful effects throughout the body. Without prompt medical intervention, uremia can progress rapidly, causing symptoms such as confusion, nausea, vomiting, and even seizures. Recognizing ammonia-like breath as an early warning sign is crucial for preventing further kidney damage. If you or someone you know experiences this symptom, it's essential to seek medical attention immediately. Early detection and treatment can slow the progression of kidney disease and improve the chances of maintaining healthy kidney function. Weird sign number 2, foamy or bubbly urine. Another strange yet significant sign that your kidneys might be in trouble is the appearance of foamy or bubbly urine. While it's normal to see a few bubbles in the toilet after urinating, particularly if you urinate forcefully, persistent or excessive foaminess can be a red flag for a condition known as proteinuria. Proteinuria occurs when protein, particularly albumin, leaks into the urine. Under normal circumstances, your kidneys' glomeruli, tiny filtering units within the kidneys, prevent large molecules like protein from passing into the urine. Instead, these proteins are retained in the blood, where they play crucial roles in maintaining fluid balance, immune function, and overall health. However, when the glomeruli become damaged, they lose their ability to effectively filter the blood, allowing protein to escape into the urine. This excess protein in the urine interacts with the water, leading to the formation of persistent foam or bubbles that resemble the froth on a freshly poured beer. The foaminess can vary in degree, but if you notice that it's not dissipating quickly and is present consistently, it could indicate a serious issue with your kidneys. The presence of proteinuria is more than just a curious anomaly. It's a sign of glomerular damage, which is often associated with chronic kidney disease, CKD. Left untreated, proteinuria can lead to further kidney damage, as well as complications such as high blood pressure, swelling in the hands and feet, and an increased risk of cardiovascular disease. Recognizing foamy urine as a potential warning sign is crucial for early detection of kidney problems. If you notice this symptom, it's important to consult a healthcare provider who can perform tests to determine the underlying cause. Early intervention can help protect your kidneys from further damage and slow the progression of chronic kidney disease. Weird sign number 3, metallic taste in mouth. A persistent metallic taste in your mouth might seem like a minor annoyance, but it could be a sign of something much more serious. Chronic kidney disease, CKD. This unusual symptom is caused by the buildup of waste products in the blood, a condition known as uremia, which occurs when the kidneys are no longer able to filter toxins effectively. When your kidneys are functioning properly, they remove waste and excess fluids from your bloodstream, ensuring that your body maintains a delicate balance of chemicals. However, when kidney function declines, these waste products start to accumulate in the blood, One of the byproducts of this accumulation is a metallic or chemical taste in the mouth, which is often described as bitter or unpleasant. This taste can persist throughout the day and is not easily masked by food or drink. The metallic taste is often one of the first signs that waste is building up in your system, signaling that your kidneys are struggling to keep up with their filtering duties. This symptom can be particularly distressing because it is usually accompanied by a loss of appetite. The combination of a constant bad taste and a lack of desire to eat can lead to unintentional weight loss and malnutrition, further complicating the health issues associated with CKD. The presence of a metallic taste in your mouth should not be taken lightly, as it may indicate worsening kidney function. This symptom is particularly concerning because it often appears in the later stages of kidney disease, when intervention is most critical. If you experience a metallic taste along with other symptoms such as fatigue, swelling, or changes in urination, it's essential to seek medical advice as soon as possible. Early detection of kidney disease can help slow its progression, potentially preventing more severe complications and improving your quality of life. If a metallic taste in your mouth persists, it's worth consulting a healthcare provider for further evaluation and appropriate treatment. Weird sign number 4, unexplained itching. Unexplained, persistent itching, particularly on areas like the back and arms, can be a troubling and uncomfortable experience. What many people don't realize is that this relentless itch can be a sign of chronic kidney disease, CKD. When your kidneys are no longer able to filter waste products efficiently from the blood, toxins begin to accumulate in the bloodstream. This buildup of waste can lead to a condition known as uremic pruritus, a type of severe itching associated with kidney dysfunction. The itching caused by kidney disease is not like the occasional itch you might feel from dry skin or an insect bite. It's often described as intense, deep, and difficult to relieve. This itching can occur anywhere on the body, but is most commonly reported on the back, arms, and legs. Unlike typical itching, which can often be soothed with moisturizers or anti-itch creams, the itching associated with CKD does not respond well to topical treatments. This symptom is particularly concerning because it can be a sign of advanced kidney disease. As kidney function continues to decline, waste products and toxins that would normally be excreted in urine begin to accumulate, leading to uremic pruritus. The exact mechanism of this itching is complex and not fully understood, but it is believed to be related to the buildup of certain waste products, such as urea, as well as imbalances in electrolytes and minerals like calcium and phosphorus. Unexplained itching that persists and does not improve with typical treatments should be taken seriously. It's more than just a skin issue. It's a signal that something deeper might be wrong with your kidneys. If you're experiencing this kind of itching along with other symptoms like fatigue, swelling, or changes in urination, it's crucial to seek medical advice. Early detection and management of kidney disease can help prevent further complications and improve your quality of life. If you're dealing with unexplained itching, it's important to consult a healthcare provider who can assess your kidney function and determine the best course of action. Weird sign number 5, swollen ankles and feet. Swollen ankles and feet might seem like a common minor inconvenience, but it can actually be a sign of something much more serious. Kidney damage. When your kidneys are not functioning properly, they may struggle to maintain the right balance of sodium and fluid in your body. This imbalance can lead to the retention of sodium, which in turn causes your body to hold on to excess water. The result? Swelling or edema, particularly in the lower extremities like your ankles and feet. This type of swelling is often a sign that your kidneys are not filtering your blood as effectively as they should be. In healthy kidneys, excess fluid is removed from the bloodstream and excreted through urine. However, when the kidneys are damaged, they may not be able to keep up with this process, leading to fluid buildup in the tissues. The swelling caused by kidney damage can range from mild to severe. In some cases, it may be so significant that it becomes difficult to wear shoes or walk comfortably. The swelling may also be accompanied by other symptoms, such as puffiness around the eyes or in the face, which can be especially noticeable in the morning. What makes this symptom particularly concerning is that it's often ignored or attributed to less serious causes, such as standing for long periods or consuming too much salt. However, if you notice persistent or unexplained swelling in your ankles and feet, it's important to consider the possibility of kidney dysfunction. Swollen ankles and feet should not be dismissed as a minor issue, especially if they are accompanied by other symptoms like fatigue, changes in urination, or shortness of breath. These signs together could indicate that your kidneys are struggling and need medical attention. Early detection and treatment of kidney problems can help prevent further damage and improve your overall health. If you're experiencing swelling in your lower extremities, it's important to consult with a healthcare provider to evaluate your kidney function and determine the appropriate course of action. Weird sign number 6, shortness of breath. Shortness of breath is a symptom that can be associated with many health issues. But when it comes to kidney disease, it's a sign that should not be overlooked. Kidney failure can lead to 2 primary conditions that cause shortness of breath: fluid buildup in the lungs, known as pulmonary edema, and anemia. When your kidneys are not functioning properly, they may struggle to remove excess fluid from the body. This fluid can accumulate in various tissues, including the lungs. When fluid collects in the lungs, it becomes difficult to breathe, leading to a sensation of breathlessness. This condition, pulmonary edema, can be particularly dangerous and may require immediate medical attention. In addition to fluid buildup, kidney failure can also cause anemia, a condition in which your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues. Healthy kidneys produce a hormone called erythropoietin, EPO, which stimulates the production of red blood cells in the bone marrow. When the kidneys are damaged, they produce less EPO, leading to fewer red blood cells and resulting in anemia. The lack of oxygenated blood can cause fatigue and shortness of breath, especially during physical activities. The challenge with shortness of breath is that it can easily be mistaken for other conditions, such as heart disease, lung problems, or even anxiety. However, when it's linked to kidney dysfunction, it often signals more advanced stages of the disease. This makes it crucial for individuals experiencing unexplained or persistent shortness of breath to consider their kidney health as a potential factor. Recognizing shortness of breath as a possible symptom of kidney disease is essential for early intervention. If you're experiencing this symptom, particularly if it's accompanied by swelling, fatigue, or changes in urination, it's important to seek medical evaluation. Weird sign number 7, high blood pressure. High blood pressure, or hypertension, is a well-known health concern. But what many people don't realize is that it can be both a cause and a consequence of kidney disease. The relationship between kidney function and blood pressure is complex and critical, with damaged kidneys often leading to difficulties in regulating blood pressure, which in turn can exacerbate kidney damage. Your kidneys play a key role in regulating blood pressure by controlling the balance of sodium and fluid in your body. They do this by filtering excess sodium and water from the blood and excreting them in the urine. In addition, the kidneys produce a hormone called renin, which helps regulate blood pressure by narrowing or widening blood vessels. When the kidneys are damaged, they may not be able to effectively remove excess sodium and water from the blood. This can lead to an increase in blood volume, which puts more pressure on the blood vessels and raises blood pressure. Moreover, damaged kidneys may produce too much renin, leading to further narrowing of blood vessels and contributing to hypertension. The problem with high blood pressure is that it creates a vicious cycle. Elevated blood pressure can further damage the delicate blood vessels in the kidneys, reducing their ability to filter blood properly. This ongoing damage can lead to chronic kidney disease, CKD, which in turn makes it even harder to control blood pressure. Over time, this cycle can lead to significant kidney damage, eventually resulting in kidney failure if left untreated. High blood pressure is often called the silent killer, because it can cause significant damage to the kidneys and other organs without causing obvious symptoms. This makes it crucial to monitor blood pressure regularly, especially if you have other risk factors for kidney disease, such as diabetes or a family history of kidney problems. If you're experiencing high blood pressure, it's important to consider the health of your kidneys. Managing blood pressure through lifestyle changes and medication can help protect your kidneys from further damage and reduce the risk of complications. If you have concerns about your blood pressure or kidney function, it's essential to seek medical advice for proper diagnosis and treatment. Weird sign number 8, insomnia and sleep apnea. Insomnia and sleep apnea might seem like unrelated sleep disorders, but they can actually be symptoms of underlying kidney disease. When your kidneys are not functioning properly, they can cause imbalances in electrolytes and hormones, which can disrupt your normal sleep patterns and lead to significant sleep disturbances. Kidneys are responsible for filtering waste and maintaining a delicate balance of electrolytes such as sodium, potassium, and calcium in your blood. When kidney function declines, these electrolytes can become imbalanced, leading to a range of issues, including restless leg syndrome, muscle cramps, and difficulty staying asleep, all of which contribute to insomnia. In addition to insomnia, chronic kidney disease, CKD, can also lead to sleep apnea, a condition where breathing repeatedly stops and starts during sleep. This is often due to fluid retention caused by failing kidneys. Excess fluid can accumulate in the upper airway, causing it to narrow and obstruct breathing during sleep. Sleep apnea not only disrupts sleep but also leads to decreased oxygen levels in the blood, which can put additional strain on the heart and exacerbate kidney damage. The importance of recognizing and addressing sleep disturbances in individuals with kidney disease cannot be overstated. Poor sleep quality doesn't just affect your energy levels and mood. It can also have a direct impact on your kidney health. Chronic lack of sleep can worsen existing kidney problems by increasing blood pressure, contributing to inflammation, and reducing the body's ability to repair itself. Moreover, sleep disturbances like insomnia and sleep apnea are often associated with other health issues, such as obesity, diabetes, and cardiovascular disease, all of which can further complicate kidney disease. If you're experiencing unexplained insomnia or symptoms of sleep apnea, such as loud snoring, choking during sleep, or excessive daytime fatigue, it's important to consult a healthcare provider. Proper diagnosis and treatment of sleep disorders can help improve your overall well-being and may protect your kidneys from further damage. Managing sleep issues early can be a crucial step in maintaining both your kidney health and overall quality of life. Weird sign number 9, dizziness and trouble concentrating. Experiencing dizziness, confusion, or trouble concentrating can be alarming, but these symptoms are often misattributed to other health issues like stress, fatigue, or even dehydration. However, these cognitive disturbances can actually be a sign of severe kidney dysfunction. When the kidneys begin to fail, they can cause anemia and electrolyte imbalances, both of which can have a significant impact on brain function. One of the key roles of the kidneys is to produce a hormone called erythropoietin, EPO, which stimulates the production of red blood cells. When the kidneys are damaged, they produce less EPO, leading to a decrease in red blood cells, a condition known as anemia. Red blood cells are crucial for carrying oxygen to the brain and other organs. Without enough oxygen, the brain can struggle to function properly, resulting in symptoms like dizziness, confusion, and difficulty concentrating. In addition to anemia, kidney failure can also cause imbalances in electrolytes such as sodium, potassium, and calcium. These electrolytes are essential for proper nerve and muscle function, including the neurons in your brain. When electrolyte levels are out of balance, it can disrupt the electrical signals in the brain, leading to cognitive issues like confusion, memory problems, and an inability to focus. These cognitive symptoms are particularly concerning because they often go unrecognized as signs of kidney dysfunction. Many people might attribute dizziness or trouble concentrating to aging, lack of sleep, or other common conditions. However, when these symptoms persist or occur alongside other signs of kidney problems, such as fatigue, swelling, or changes in urination, it's important to consider kidney dysfunction as a possible cause. Ignoring these symptoms can lead to further deterioration of kidney function, as the underlying issues remain untreated. If you're experiencing persistent dizziness, confusion, or trouble concentrating, it's essential to seek medical advice. A healthcare provider can perform tests to evaluate your kidney function and determine whether these symptoms are related to kidney disease. Early diagnosis and treatment of kidney-related cognitive issues can help prevent further damage and improve your quality of life. By addressing these symptoms promptly, you can take important steps toward protecting your brain and your kidneys from further harm. Weird sign number 10, frequent muscle cramps. Frequent and painful muscle cramps can be more than just a minor annoyance. They may be a sign that your kidneys are struggling to maintain the proper balance of minerals in your body. Muscle cramps, especially when they occur often, can be linked to electrolyte imbalances caused by kidney dysfunction, particularly low levels of calcium and high levels of phosphorus. Your kidneys play a crucial role in regulating the levels of various electrolytes in your blood, including calcium, phosphorus, sodium, and potassium. These minerals are vital for many bodily functions, including nerve and muscle function. When the kidneys are not working properly, they may fail to maintain the correct balance of these minerals. This imbalance can lead to symptoms like muscle cramps. One common scenario in kidney dysfunction is the disturbance of calcium and phosphorus levels. Healthy kidneys regulate phosphorus levels by excreting excess amounts in the urine. However, when kidney function declines, phosphorus can build up in the blood. At the same time, calcium levels may drop because the kidneys are also involved in converting vitamin D into its active form, which is necessary for calcium absorption. The resulting low calcium and high phosphorus levels can trigger muscle cramps, which are often felt in the legs, but can occur in other parts of the body as well. These cramps can be painful and disruptive, affecting your ability to move comfortably and sleep soundly. What's more, because the underlying cause is related to kidney function, Persistent muscle cramps can be an early warning sign of chronic kidney disease. Unfortunately, this symptom is often overlooked or attributed to dehydration, overexertion, or other more benign causes. If you're experiencing frequent muscle cramps, especially if they are severe or accompanied by other symptoms like fatigue, swelling, or changes in urination, it's important to consider the health of your kidneys. Persistent cramps may indicate that your kidneys are not effectively balancing the minerals in your body, which could be a sign of worsening kidney function. Consulting a healthcare provider is crucial if you're dealing with ongoing muscle cramps. They can perform tests to assess your kidney function and electrolyte levels, helping to determine the root cause of the cramps. If you've noticed any of these strange and often overlooked signs, like ammonia-like breath, foamy urine, or persistent muscle cramps, it's crucial not to ignore them. These could be early warnings that your kidneys are in trouble. Don't wait until it's too late. Consult a healthcare provider to get the proper tests and diagnosis. Early detection is key to preventing further damage and maintaining your overall health. Remember, your kidneys are vital to your body's overall function, and taking care of them should be a priority. Regular checkups can catch problems before they become serious, and maintaining a healthy lifestyle with a balanced diet, regular exercise, and proper hydration is essential for keeping your kidneys in good shape. Protect your health by staying informed and proactive. Your kidneys and your body will thank you.